Good day, class. In this video, we are going to study a new disease, muscular atrophy. The muscular atrophy refers to the muscle weakness, general muscle fatigue, and/or loss of muscle mass, with motor impairment. Especially after long term, the patient will present as motor impairment, so they could not move some parts of their body because of loss of muscles. This disease name is actually the term in Chinese medicine. It can be seen in many medical conditions that are related to the nerves, the neurological problems. So the main presentation is the loss of muscle, the weakness. When talking about the etiology, I want you to have a look at the image first, the image on the right side, the plant, the leaf. Some leaves are still healthy, but some are withered. So the muscular atrophy is very similar to this part of the plants. The withered leaves. So when you think about the etiology, why the leaves will be withered? How many possible causes it can be withered? So firstly, lack of water, the leaves will be shrink. Or too much heat, or damp heat if you water the plants at noon in summer, and then you don't actually water enough. So you water a little bit, but the sun, and especially in summer, 40 degree, it causes the damp heat. It also will burn the leaves, will cause withered. So these are the possible causes for the withered leaves. Same as our human body. The muscular atrophy is the withered of the muscle. So it's the withered with quotation mark, the withered of the muscles. So when you think about the etiology, you think about the damp heat or the heat, toxicity. Toxicity in Chinese medicine, especially from the basic theory, toxicity actually we refer to extreme heat. Improper diet, weakness due to long-term diseases. Improper diet, especially the improper diet, and results in the weakness of spleen and stomach, because the spleen and stomach are in charge of the muscles. So similar to the other diseases, from the etiology, we're going to focus on exogenous and endogenous. Exogenous can be damp heat, also can be heat, etc. Long-term fever, internal heat. So it can be either damp heat or heat. It can both. From exogenous, it also can be endogenous. Depends on individuals, and it depends on individual's situation. So from these two causes, it may result in the lung heat results in dysfunction in the water distribution. So that's what we said here. The withered leaves, lack of water. If dysfunction of the water distribution will result in insufficiency. Water is in. So when you see the muscle, the atrophy, the weakness of the muscle is similar to the shrinked muscle. If you put enough water there, it can expand, it can recover. So that's the water, the yin, is something you need to focus on. The heat also will consume the yin. The heat will consume the water. So the heat itself will result in insufficiency. The heat may result in the lung heat, may affect the lung heat, result in the water distribution, but the heat and the toxicity itself will result in insufficiency. The damp heat, this damp heat will depend on the volume of the dampness and heat, which one is dominant. It can be the dampness or the heat. So it may affect the lung, It may affect the water, the influid in the body directly. It may result in lack of nourishment in the muscles, blockage of meridians. The second possible cause is sitting or sleeping in a humid environment or in rain. This may result in heat due to stagnation. So this heat, the treatment for this heat, we need to clear the stagnation, activate the circulation. But in the meantime, the sitting and sleeping in the humid environments or working in the humid environment also may affect the spleen function, will result in the spleen deficiency, may result in qi and blood deficiency. So this cause may result both. Once from the stagnation will result in the internal heat, stagnant heat. Damp heat, and the damp heat will block the meridian. Blockage from the meridian may result in the lack of nourishment. The spleen and stomach deficiency may result in the resource of the qi and blood. The lack of qi and blood, because that's where the acquired qi comes from. The spleen and stomach deficiency can be from the environment, the humid environment, because the spleen dislikes humid. Or it also can be from improper diet, may affect the spleen function. So these two can affect the spleen, will result in lack of nourishment in the muscles. Overexertion. Overexertion, it can be the overexertion from the overwork, or sexual life. So it will result in accents and blood deficiency, or even overthinking. You will consume the accents and blood. All of these may result in lack of nourishment in the muscles, or blockage of the meridians, or blockage of the meridians. So our treatments will focus on to nourish the muscles. But how to nourish? Something you need to focus on the spleen, the axons, the kidney and the kidney and liver, the axons and blood, the liver, something you can focus on. If this patient due to heat presents as a red tongue, yellow coating, then you can focus on the heat. But more commonly, especially this kind of patient, the atrophy, most of them are long-term. After long-term, the patient may present as deficiency. So you always need to focus on the spleen, kidney, and the liver. The syndrome differentiation will follow the etiology. The main symptoms will be the muscle weakness, fatigue, loss of muscle, with or without motor impairments. Especially at the beginning, the patient may only present as weakness, but as the disease progresses, the patient will present as motor impairments. The lung heat, the patient may present as fever, excessive sweating, weakness, irritation, thirsty, yellow urine, red tongue, yellow coating. Sometimes you will ask, but from these symptoms, I don't see anything directly related to lung. Why we need to focus on the lung heat? One of the reasons is because the lung heat, this syndrome is original from 黄帝内经. Also in 伤寒杂病论, it describes the lung heat. The second reason is because of the lung, the function of the lung, the water distribution. So the weakness or the loss of muscle mass is due to the water distribution, the dysfunction of the water distribution. This is also the lung, and then combined with the heat. The heat affects the lungs function, so the lung heat. A patient also may present as damp heat. Damp heat will cause the blockage. The damp heat, the patient will present as progressive weakness, more severe in low extremities. The dampness moves downwards. A hot sensation, dampness, that's the heat. Yellow urine, the heat. Red tongue, greasy coating, yellow greasy coating, the damp heat. The patient presents as damp heat. Apart from these symptoms, they also may present as the heaviness sensation in the anus area. Slippery rapid pulse. Spleen and stomach deficiency, because the spleen is where the acquired qi comes from. The spleen also in charge of the muscles. So the treatments we will focus on, especially for the deficiency, we will focus on the spleen atrophy after long-term poor appetite, abdominal fullness, loose stool, fatigue, pale tongue with greasy coating, with or without teeth mark. So these are all spleen and stomach deficiency. Also, after long term, it may result in liver and kidney deficiency, slow onsets, weakness in the waist and knees, dizziness, tinnitus, the kidney related to the ear. Red tongue with less coating, yin deficiency, liver and kidney deficiency, especially liver and kidney yin deficiency. Yin deficiency with no coating, that's why less coating. A deep, steady pulse. The treatment principles. Due to lung heat or damp heat, we're going to clear the heat, dispelling the pathogens, activating qi and blood circulation. Because of heat, this is an excess. We will use acupuncture with a reducing manipulation approach. Due to spleen and stomach deficiency or kidney and liver deficiency, we're going to focus on tonifying qi and blood. We can use the combination of acupuncture and Moxibustion with reinforcing technique. The main points we focus on the hands and foot Yangming meridian. Because the Yangming meridian is the meridian has a lot of qi and blood. So we can focus on the hand and foot Yangming meridians. Also because this symptom or this disease, which is lack of nourishment. The nourishment is qi and blood, so we can focus on Yangming. The hand Yangming meridian, the foot Yangming meridian, and actual B2 jiaji points. In the upper extremities, we can use large intestine 15, 11, 10, 4, 三角 5, and jiaji. In the neck and chest region. In the low extremities, we can use the stomach, 31, 32, 36, 40, gallbladder 31, gallbladder 34, spleen 6, and jiaji points in the lower back region. Apart from these, we also can select the points on the bladder meridian, especially the first line of the first line of the bladder meridian that related to the 脏腑 organs. So it can enhance the 脏腑 function. 三角 5 and GB31, they belong to the 少阳 meridian, the hand and foot 少阳 meridian. These 3 points can assist the circulation of qi and blood of the Yang-Mi meridian. Also, the GB34, the GB34 is the meeting points of the ligaments. So the atrophy, not only the weakness of the muscles, also accompanied by the weakness of ligaments. So we can use GB34, where the ligament meets, can treat or improve the function of ligaments all over the body, GB34. So that's how we select these points. Spring 6, the three in meridians course on spring 6, 三阴交. So we're going to use spring 6 to adjust the function of the spleen, liver, and kidney. Due to lung heat, we can add lung 10, lung 5, or bladder 13. Bladder 13, the backstool points related to the lung. Due to damp heat, we can add spleen 9, yin ling quan, rong 3. Spleen and stomach deficiency, we can use the Moxibustion or the combination of acupuncture and Moxibustion. Bladder 20, 21, level 13, rong 12. Liver and kidney deficiency, bladder 18, 23, level 3, and kidney 3. Some of these are the yuan source points, some of these are the backstool points related to the specific zang and fu organs. Special needling technique. If we don't mention the special needling technique, you can just use the normal insertion, even manipulation technique. Lung 10 and lung 5, a reducing technique of pricks to cause bleeding. In the upper extremities, we're going to focus on the hand Yang-Mi meridian. In the lower extremities, focus on the foot Yang-Mi meridian. Apart from these techniques, the skin needling technique and electrical stimulation also can be applied in this disease. So the injection will be very similar to the others. You have to achieve, especially for the electrical stimulation, you need to achieve the qi arrival first and then apply the electrical stimulation for half an hour. Although we introduced the acupuncture treatments for muscular atrophy, in the practice, sometimes it's not easy to heal this problem. No matter from Chinese medicine or conventional medicine, it is not easy to heal this problem. So what we need to do, we can assist, try to improve the situation. But in the meantime, we also need to stress the patient to exercise, to try to recover the function. So they shouldn't rest and wait for the treatment only. They also need to exercise actively. If the patient cannot move and lie in the bed all the time, we also need to stress to avoid or be careful of the bed sore. So either to move the patient quite often or to use the air matrix. Thank you for your attention.